All right, what's up, folks? Guerrilla Radio episode 12, back at the gym with Susie. One of the topic we're tackling today is, we'll just call it soft tissue work, right? And with everything that encompasses within that. So we did a video specifically on ART and Graston. Susie's been doing that stuff for years, so she gave us some good insight. But inevitably what happens, if you've ever done a class here at the gym or have seen Susie for her rehab stuff or just been in rehab in general, you've probably done soft tissue work and you might only know that it just sucks and it's painful. So we want to kind of talk about why we do soft tissue work and the benefits of that versus static stretching. So we'll start with an analogy that I think carries over well, and then Susie will jump in. So imagine this band. It's a rough analogy, so just bear with me. This band is your muscle. And let's say we have this knot, okay, AKA trigger point, or there was some damage here years ago, but whatever has happened, we have a small ball of tissue that is kind of clogged up, or it's just not moving well at all. So if all I ever did was static stretching, what would inevitably happen to this knot in my muscles? Nothing, right? It would get worse, it would get tighter, and eventually that would give. And that's gonna give above or below where that knot is, all right? So the old adage of just doing, static stretching all the time is kind of come and gone. So that's why we do soft tissue work, either through manual therapy for somebody else or lacrosse ball, foam roller type work. So Suze, go ahead and talk about a little bit about what you do and what the importance of it. I know you talked a lot of good stuff about how often we should be doing everything and all that kind of stuff.
So I think the first thing to kind of tie into this analogy is that when there's scar tissue or a trigger point or wear and tear in a very specific area, and like you said, it kind of like something else has to give, and so then there's more wear and tear. Mm-hmm. But I think the important thing to remember is that when you have inconsistencies within your muscle or your tissue or ligaments or anything like that, and you've got some soft tissue damage, and there's inconsistencies to the way that the muscle fibers lay and those kind of things, what ends up happening is it ends up decreasing your flexibility, your range of motion, the ability for the muscle to function properly, and then in turn, a lot of times you'll end up seeing issues with proper form with workouts, or posture issues, which can lead to more wear and tear in the wrong spots. So I think that's kind of the important thing is, even if you don't necessarily feel it right away, or you think, oh, it's just one small spot, like it's like a rippling effect. So it's really important, especially if you're training as repetitive or as high intensity, lots of repetitive movements, anything like that. It's super vital to add mobility work to your every single day life.
So get into that. So that's the thing. Yeah. The consistency of when you do it is key.
Yes. So I was reading, and I'll post the article, but I was reading about how they were talking about that even a 60-minute massage once a week or once every 2 weeks is not nearly as beneficial as doing 10 minutes of mobility work, like good, heavy, soft tissue work, daily. You actually get more change and it's more consistent if you do daily work rather than doing once a week. Because what ends up happening, what they were saying basically, is what happens between day 1 and day 7 when you're going back in for that massage. A lot changes. So I think that's the number one thing is, even if you come to see me for ART or Graston work, here in the gym and on Wednesdays, and you're coming every single week, the important thing is to always do it at home as well. And I always tell people, do this, this, and this. But in order to really get good change, every single day is important. Even when it comes to Graston technique, which is when you use basically like these little steel tools that help to break up scar tissue more efficiently, restart the healing process, get rid of a lot of pain, inflammation, that kind of stuff. But almost every single case study that I saw was you at least came twice a week, and you at least came for about 4 or 5 weeks. So 8 to 10 sessions before, and people felt better usually within 3 sessions. So that's kind of the key thing is, even if you feel better in 3 sessions, you're not better. The issue isn't resolved. Yeah. So I think that's part of it too, is just making sure to carry through and actually complete the treatment to really get good benefits. Yeah, it's like showing up to the gym once every other week and expecting results, right? And for a lot of people too, let's say you become aware of all of this at say 30. Well,
and you know you have a rigid thoracic spine, shoulders are rolled, you're not going to fix that. Even in 10 sessions a good start, but that takes a very long time, right? And I think the reason why I'm trying to build so much value for this is because this stuff can be tedious. It can suck sometimes. If you ever rolled around a foam roller for 15 minutes or a lacrosse ball for 10, it's not that enjoyable. People don't look forward to it. But it is like the workout too. A workout's hard, you don't look forward to it, but it's what the end result is. And I think coming off what you're saying, it's important to recognize that pain is an abnormal state.
Yes.
It's not normal. Now it feels normal in our day and age because of postural issues, sitting too much, lack of physical activity, poor nutrition for the general populace, but it is an abnormal state. So if we're setting on a foam roller or a lacrosse ball or something else and it's absolutely painful, that tells us that that's an area we need to dig into.
Yes, 100%.
Right? And what's really crazy, and you can geek out on a whole other level with this stuff, is looking at how interconnected all the muscle and fascia is of the body. Right? If you test somebody by just standing still and reaching down to try to touch their toes and measure where their hands go down, and then just take a lacrosse ball to the bottom of the foot and beat up the lower fascia of the foot, and then on both and try it again, you will almost always see a significant increase in how far they can go down. And that just translates into how interconnected all the fascia and all the muscles of the entire body are.
Yeah, most people think like you go down to touch your toes, oh, you have like poor hamstrings.
Right.
And it's like, well, there's your whole posterior chain.
Yeah. Your body is a system of systems.
Yeah.
And when we're talking soft tissue, we're talking the actual muscles themselves, right? And you got the tendons, you have the ligaments, and then you have the fascia. And the fascia is the sleeve that encompasses the muscles themselves. So tackling every component, and then looking what, Kelly Starrett's got some obviously great stuff on all of this on Mobility WOD, but looking above and below stream is his language, which of course we need to look at. One major thing too is shoulder pain. A lot of people get reflective anterior shoulder pain, right? My shoulder hurts right here, so something is happening here. The vast majority of the time, we're going to see issues in the rotator cuff, right? Infraspinatus, supraspinatus, teres major, those muscle groups are typically where we're going to find these trigger points, and that pain is being referred to the anterior shoulder. Even crazy stuff with knee issues. I was reading about a guy who had knee issues, another case study, and he was a pretty well-versed strength and conditioning coach, and he did everything you thought you should do. Went and saw a specialist for some functional exams, and he realized that the peroneals, the outsides of the legs, were totally beat up, and he had tons of trigger points. He rolled those out for several weeks, and the knee pain dissolved. So there's no perfect answer, but an understanding that it's not isolated. Just because the pain is there doesn't mean that's where the problem is. We have to be very, very consistent. And so let's talk about this then, and we'll finish up with what do people do, right? If they know I have my, you pray this all the time, I have a bad shoulder, I have a bad back, I have a bad knee, right? Where would you start somebody off? What would be step one for that person?
So I always tell people the biggest and the most easy, like the easiest thing to start with is the site of pain. So wherever it hurts, like take a lacrosse ball, roll around on it, the spots that hurt the most need the most work. So that's kind of number one, easy, but that's part of it too, is you don't want to necessarily just pick one little like thumbprint, like you want to actually try and hit the whole joint, really see what spots, anterior, posterior, everything that's going on. And so I think that's the number one thing to do. But also when you have an issue like that going on, then it's also telling you that you have, most likely you're going to have quite a bit of inflammation in the area also.
Yep.
So it's also making sure that in order for proper healing and to resolve the issue quicker, making sure that you're reducing inflammation or inflammatory triggers or foods or things like that in your diet, making sure, like we talked about last week, omega-3s.
Right, omega-3s.
Even like vitamin D, you'd be surprised. Everything's going to kind of play into how the body responds to inflammation and how much there is and that type of thing. We were talking about even insulin and that, as well. So even reducing your sugar intake, so your overall sugar intake, a keto diet is really anti-inflammatory. So even like short term to clear up an issue, that's an awesome meal plan to follow short term or long term. But and then having tools. So the other thing, like we were talking about with stretching, that you have to stretch for a significant amount of time to really get over that.
Like static stretching.
Yeah, that's sympathetic response and get into true relaxation.
So layer on that a little bit.
So I'll have to look for, I can't remember which source it was that I was reading through that had some interesting stuff about basically that soft tissue work specifically, which means whether it's like ART, which is active release technique, Graston, a lacrosse, like some type of outside source, like a lacrosse ball, a band, a foam roller, things like that. Something external that's going to allow you to get deeper into it. So some type of soft tissue work actually allows you to get past that parasympathetic, or get into the parasympathetic state instead of sympathetic. So instead of that fight or flight, where your body's going to want to protect itself. So it feels something uncomfortable and it like tightens up even more.
Right.
So it doesn't want to go into that state of allowing the body to break through some of that scar tissue and relax the muscle and go into that state of relaxation, which then can allow it to go into a state of releasing pain and then healing.
Yes.
So I think that's the important thing too, is having, it can't just be like go, and I know I love yoga. If anyone sees my Facebook page, I'm obviously a huge fan of yoga.
Yeah, we know.
But yoga is not going to be like the only, like just plain simple, like go through some movements. It's not going to be something where you all of a sudden work through all of your aches and pains.
Right.
And that's why I love the yoga studio I go to, because they have a lot of different classes that incorporate like ropes. So you're having added mobility to joint mobilization, things like that. They do classes with lacrosse, like these mobility balls, all different sizes, all kinds of stuff. So I think that's the key, is you really do have to kind of know your tools in order to get past that, limiting.
Yeah. I like that. I think that's the first approach, because here's the thing: you're really not going to hurt yourself by using a lacrosse ball foam.
Go buy pain tolerance.
You might waste some time if you're doing it wrong, but you're not going to hurt yourself. So the shotgun approach is where I first started. If you're like, I don't know what to do, buy a lacrosse ball for $3 on Amazon and just dig into the area that bothers you. I think after that, if we're not seeing any results, then go find some sort of specialist, because then I would take you into, you look at some sort of functional exam and you can start to find muscular imbalances
where it's coming from.
The root of the cause. So there's two different approaches there. And then ultimately, I love the idea that we should be able to perform maintenance on ourselves, right? That was another mobility WOD phrase that I really attached to. You should know how to perform basic maintenance on yourself. And when you have those tools, then life becomes a lot easier, right? So those little tweaks don't turn into long-term issues. You can fix them on the front end. And I think we'll close with ignoring the problem, right? You can always push it down the road, but when they show up big time when we're 50, 60, 70, even not even that long perhaps. So taking the time to dig through the pain, to find the root cause of it and pull it out and fix it is where we're really going to find long-term
damage.
damage.
A lot of times you're not going to feel the pain until you put the lacrosse ball on it and lay on it, and you're like, wow, I didn't even know that hurt so bad.
Right.
So I think that's part of it too, is just being really in tune with your body and know, kind of after a workout, usually these spots are going to be the most, and that's why you guys have it structured so perfectly. The mobility goes with the workout that day.
Totally.
So just using those tools from workouts and just try and remember, okay, well, these movements, these are what we worked on, and that's what I should work on afterwards, just to follow up with it.
Perfect.
Yeah.
All right. See you next time.